So we're doing, as we know, for DLBCL refractory setting, there are two FDA-approved bispecifics, glofitamab and epcoritamab, but there is not much data at this time existing regarding the efficacy and safety of these bispecifics in elderly patients. So to that end, we did a multi-center retrospective study through the CUBIC Consortium consisting of 9 sites to look at specifically outcomes of these two bispecifics in the commercial setting for relapsed refractory DLBCL in elderly patients 65 and older, and how do these outcomes compare to younger patients? In terms of our patient cohort, we have 185 patients over 65 treated with standard of care bispecific in our study, and 83 patients younger than 65. And in terms of the outcomes, the safety appears to be very overall comparable. In terms of high-grade CRS was observed in 10% of our elderly patients, and high-grade ICANS was observed in 11.5% of our elderly patients. With respect to responses, the responses were also very comparable in our older and younger patients. The CR rate is 35.8% in our younger patients and 35.7% in our older patients. So very comparable CR rates in both groups. And PFS also appears at the 1-year time to be comparable, 27% versus 30%, and overall survival 1 year, 49% versus 39%. So overall, our study has demonstrated in the real world setting that standard of care bispecifics can be safe and very effective in our elderly patients with comparable outcomes to those who are younger. I think we need longer follow-up, and of course, limitations of the studies that we did not have geriatric assessments and quality of life data, which should be incorporated more in the future prospectively. But I think this study gives encouraging data that elderly patients should not be excluded from getting bispecific, in fact, benefit greatly with good efficacy and safety and comparable outcomes to those who are younger.